This episode of To The Point is sponsored by Tarsus. Tarsus Pharmaceuticals applies proven science and new technology to revolutionize treatment for patients, starting with eye care. Tarsus is advancing its pipeline to address several diseases with high unmet need across a range of therapeutic categories, including eye care, dermatology, and infectious disease prevention. Tarsus is proud to announce that Xdemvy Lotilaner Ophthalmic Solution 0.25% is now available to prescribe.
Ocular surface disease. It's complex, chronic, and progressive, but rife with opportunity for the enterprising optometrist.
The mission of this podcast is to make this condition more understandable and accessible to those interested in specializing in it. So let's get to the point. Welcome to another episode of the To The Point podcast. My name is Jackie Garlich, and I am joined by my co-host, Leslie Odell, and we are thrilled to have a guest with us today. Please welcome Dr. Mila Ioussifova. So Dr. Mila graduated with honors from the New England College of Optometry and completed a residency program in community health and ocular disease in Boston. She's a fellow of the AAO and was honored to present at the AAO Centennial Meeting in San Diego, California. She recently joined the AAO Anterior Segment Section Leadership Team as the Communications Chair. Dr. Mila served as an adjunct clinical faculty at the Pacific University College of Optometry and was an examiner for the National Board of Examiners in Optometry. Dr. Mila opened a boutique-styled private practice in 2013, offering advanced dry eye treatments, nutritional counseling, and aesthetic services. She recently studied human nutrition and functional medicine at the University of Western States and is in the process of becoming a certified nutrition specialist. She is passionate about treating dry eye disease while incorporating nutritional and lifestyle changes. Dr. Mila is an active member of the AOA, the Oregon Optometric Physicians Association, the American Nutrition Association, and the Ocular Wellness and Nutrition Society. Her philosophy is to treat the whole person, not just the disease. Dr. Mila, welcome. Thank you so much for joining us.
Thank you for having me. I'm excited.
I am too. We've got a lot to cover. I mean, it's maybe obvious from your intro, but we're going to be talking to you about nutrition and dry eye and how those two things exist together and how we need to be talking about both of those things. But tell us a little bit about your background, your path to optometry, like your current practice info. We know a little bit about you, but tell us more.
Yeah, so I graduated from Nuenco or NECO. When I was in school, it was Nuenco. And did a residency, as you said, in Boston. And then I moved back to the West Coast, and my family's in Portland. And I was, once you're the Northwest in me, was calling me back. So I moved back to Oregon, to the rainy Portland, Oregon. And I opened my practice in 2013. But I was also practicing as a adjunct for Pacific University. Love the education, love working with students. And the practice, pretty much from day one, I was focused on dry eye. It is a boutique style, very similar to your practice, Jackie. It's kind of high-end optical, very personalized, care, no rushing through your cases or patients, right? Taking the time type of vibe. And, dry eye was obviously, we all know this is such a common problem that from day one, that there was just no brainer. Like I had to solve these problems. These patients that were coming in with, if they already tried all these, home treatments, were not getting anywhere. I didn't want to, I was getting frustrated that I need solutions. So from day one, I invested into, advanced diagnostics, like we do microbiome on everyone. I think this is something that I hope just becomes for, more mainstream and becomes a part of pre-testing, because we check for glaucoma, we check eye pressures for everyone, and dry eye is way more prevalent than glaucoma. So something like that. And for point of care testing, tear lab, inflammatory, things like that. And then advanced therapeutics, in office treatments, lipoflow, miboflow, radio frequency, IPL I've been doing for about 5-6 years now, I think. So I was probably one of the first ones to get intense pulse light, and in Oregon for sure. And really, and now the latest thing I do along with nutrition, which we'll get into, is biologics. So we do in-office blood draws, which I do myself, and then we do serum preparation. By we, I mean I prepare serum, autologous serum eye drops, and autologous PRP eye drops. So we make that within an hour, and have patients, take their drops. So that's the newest thing that I've kind of added to my dry eye. But to answer your question about nutrition, you can do, as you know, dry eye is multifactorial, complex, as your podcast says. It is complex. And there's a lot more to it than we don't know. And one of the things that it was just kind of an organic sort of flow into nutrition, because a lot of these patients have autoimmune problems, they have other comorbidities with dry eye. We know diabetes and high blood pressure and rosacea, that's a big one. So these patients were, yes, even with the best tools I had, sometimes it was not enough. And I really had to kind of look under the hood of the car, right? And really look at their gut health, and look at their lifestyle, their nutrition, and make that part of my treatment protocol, treatment plans. And that's when I really start seeing big changes, when I start treating patients as a whole, and not just their eyeballs or their skin.
I think so much is happening around that gut biome, and how that's influencing the ocular surface. And I definitely think, there's a lot to learn in nutrition. So I applaud you for getting this degree in addition to everything else that you're doing. How receptive are patients to having this conversation? Because I think lifestyle is the biggest challenge to change for our patients. So I like what Jackie said with your intro about you have these nutritional consults. Um, how receptive are patients to really sitting down and hearing what they're doing that could be not helping their disease?
Obviously there's going to be a variety. Some patients just want quick fixes, right? That's same thing with dry eye treatments too. They just want a quick fix, um, and then others. And I primarily at this point only see dry eye patients. My schedule is pretty much 99% dry eye, and these are referrals from other doctors or internal referrals and things like that. So a lot of these patients that have seen multiple doctors, they're coming to me. They're ready to do anything, right? They are miserable. They've seen, 4 or 5 different doctors. They've been told there's nothing else to do. So they ask me, what else can I do? What can I eat? What can I not do? How is that? So maybe living in certain areas of the country, I'm sure it's going to be less popular to do, but living in Northwest, in Portland, people are more mindful of those things, of their diet and kind of what they're putting in their body or on their body, on their skin and things like that. So they're more open to those types of recommendations, but not everybody is. So I have to be very gentle about that, right? I'm not going to say you have to change everything, and you have to, what you're doing is wrong, what you're eating is wrong. So there's that fine line of being supportive, and I'm here to offer any of the services that they want. So some patients will want more than others. Some will just be like, don't take my diet Coke from me. And I've heard that, I've heard patients saying like, don't take that, that's like the only thing that makes me happy. I'm like, okay. I won't do that. So there's a fine line, right? You have to respect, because mental health, that's another big factor in these patients with dry eye. I have to be very careful and supportive, and a lot of these patients are very vulnerable, and they have, I mean, I've heard it all. I've had patients that write me letters before they come in saying I'm their last resort because they're suicidal, and so it's dry eye. I mean, you treat these patients too. It is so complex, it's so deep, and it really affects. And sometimes that's all patients need from us, is to find a doctor who understands, right? To actually understands the disease and doesn't dismiss them, even if we can't help them yet, or they're not feeling better yet with everything we're doing. They just know that we're there to listen. I'm gonna sit there. If they're crying, I'm gonna listen to them, and I'm gonna give them all the support I can.
That's really I mean, that is my goal, to see all dry eye patients. So you were goals for me to just have my clinic full of dry eye people. I was reading some research on the like AIP diet for my autoimmune patients, and maybe you're familiar with this, but I personally don't feel super comfortable talking to a patient about their diet changes because I don't have any nutrition background. But I'm wondering if you now have studied this, and have nutrition experience, but is there something you can recommend to the average OD who would like to talk about nutrition, but maybe doesn't have the confidence or the knowledge to speak about that? Are there easy recommendations that you ought, right off the bat, will make with a patient?
I think that one is a good one. The autoimmune paleo diet is a good one, kind of general, and there's some resources out there. There's good research, and in the beginning, I was kind of having patients do like a Whole 30 diet, just kind of like a general, where we know that those protocols work in reducing inflammation, dampening inflammatory mediators in the body. So I think that that's a good place to start. But that's exactly why I went back to school to become a nutritionist, because that's how I felt. I felt like, what do I know about this? And if the patients are asking specific things on protocols, specific, supplements and things like that, do I really understand this? But not to say every optometrist, every eye doctor needs to do what I did, but I think that this is really one of the reasons why myself and another optometrist slash nutritionist, we put together this dry eye nutrition protocol, so that for doctors like you who are treating patients with dry eye who want more on the nutritional support, is there something that's specifically formulated, specifically put together with these patients in mind. And that's where this protocol kind of came alive.
Yeah. So tell us more about it. It's called the Dry Eye Nutrition Protocol. What is it called again? Tell us the program.
Yeah, so it's dry eye nutrition program. It's a 10-week program where we each week we have, it's like a drip down sort of like program. So they each week they get like a new new week opens up, and there's recipes, there's protocols, there's information. So we focus on gut health in the beginning. The first month is gut health, so really supporting the microbiome, and there are some supplements on microbiome and gut health, and for leaky gut and things like that. And then again, ton of recipes and recommendations and tips and tricks on like things to replace and what's good, what's not. And then the second month we focus on the immune system, so the anti-inflammatory protocol. So again, therapeutic foods and anti-inflammatory foods, and removing or replacing things that cause inflammation. And then on the third, kind of like final month, so it's 10 weeks. So it's first 2 months, and the last 10 weeks is on mental health. So we kind of actually emphasize that along the way. We emphasize the role of the parasympathetic nervous system, the role of sleep and mindfulness, meditation, exercise, things like that to kind of help to regulate our nervous system. Because as we know, when most people, they have their sympathetic nervous system is on overdrive, and that's your fight or flight, right? And that's when the high cortisol, high inflammatory mediators are, on upregulated, and then we have downregulation of, healing properties. So our parasympathetic nervous system, the opposite, is on when we're sleeping. That's when we digest, and that's when we secrete from our glands. So right, so we emphasize that it's not just about treatments that you're doing; it's about internal, your vagus nerve involvement, and how that kind of regulates your immune system and your inflammatory mediators.
You've implemented this in some of your patients,
Mhm.
presumably, right? Like a different protocol. What has been the response from your patients? Like, have you seen good outcomes from this? Like, what do your patients tell you?
Patients, again, it's not to replace the other treatments, right? So this is supportive, so this is to support. So because I treat patients with dry eye, and I do IPL and immunomodulators and other biologics and things like that, so they're getting better. And but this is just kind of like the icing on the cake, right? So this when they're feeling better, so it's not, if they only did the protocol by itself, then I would have a better answer of saying, like, well, the protocol itself treats dry eye, which I can't say that. But in combination with everything I do, the feedback that I'm getting, yes, I actually feel, my eyes feel better. But the other feedback is great, is that they say, I'm not bloated anymore. I actually feel like I have more energy. My skin is better. I'm sleeping better. I feel less anxious. And so that's all from from this protocol, from the nutritional support, because that's part of that healing. Like, I can't just, again, if I could just do treat dry eye the way I've been doing, only with the in-office treatments and pharmaceuticals and things like that, I wouldn't have gone back to school. That was a lot of work to learn nutrition. So that was just that extra, like, support that these patients need, because they are so complex.
Yeah, it's funny because one of the easy things that I've talked to patients about over the years is just hydration, right? And
Mhm.
just your body hydration matters. Your tears are made predominantly of water. And so I would have that conversation with patients. How much water are you drinking in a day? And the responses you would get were so funny. Like, well, I cut my grape juice with water. So they were like counting that as water,
Yeah.
or like, just coffee. And you
Coffee
really
has water, yeah.
yeah, people are severely dehydrated, which is one funny thing. But what I was wondering is the stress and anxiety part of this, like your last chapter. I feel like that's where I struggle the most. I have a lady that did all of these things. She went on a Whole30 diet. Um, Her dry eye flares every fall around the time that her mom died. And literally, she does come in always crying in November, and I feel like I'm just part of her, psychological well-being now. But it's interesting, and I wonder, like, do they go back to that module that's on this, mental health, if you that you have, and kind of seek it out when they feel high stress times and things like that? Because that would be brilliant, and I would definitely need my patients on your module
Yeah.
and your protocol.
Yeah. So the way we have it, which, it's still kind of new, we're trying to figure out if it's if we're gonna have, if the patients are gonna have, like, ongoing access. Right now, we have them to access it for 3 months, and after they're done, there's like extra month or so, because once they're done, it's so, we don't know if it's any of value for them. But maybe, that's something to think about. And we're sort of, we'll probably be tweaking it, and as we have more people going through it, what works, what doesn't. Maybe they need a little longer of that part of the protocol. Again, we, like I said, we sprinkle that mental health importance of that, controlling stress and anxiety, and kind of, um, along the protocol from the beginning. But we really focus on that, and kind of that gut and brain axis, and really focus on the link at the end. But that's the thing, right? That is a big struggle, and we do see high stress and anxiety in these patients, and sometimes it's like, is dry eye triggering that, or are is the stress and anxiety triggering dry eye? It's kind of this loop, right?
I feel like I should take this class, or this nutrition program simply for myself. I feel like, so there was a period of time where I was listening to a lot of nutrition podcasts, and there was this one by this cardiologist resident at the time. Her name was like Dr. Danielle Bellardo. I don't know if you've ever heard of her, but anyway, she talks about basically how nutrition is literally the reason for all of most illnesses and most diseases. And it's, if you just change what you consume and like treat your body well, your body will do well if you just treat it nicely and eat, good plant-based foods. And I just wonder, that I think is a very big topic to start with a patient. So how do you incorporate that? I mean, we talk often about, we have a speed questionnaire, and then we're talking about this, and then we're talking about this. Where does nutrition fit in your dry eye patients? And is this like reserved for patients that are not responding as you want them to, or do we bring this up on the front end? Like, how do you handle it in your clinic?
So I do some in-office testing, but you don't have to. I think just as simple as asking, I will ask patients, "How's your diet?" Is just as as simple as that. How's your diet? And then oftentimes they'll say it's pretty good, and then you'll say, "Well," and then I'll follow up. What did you have this morning for breakfast? And it's usually like a bagel or a muffin or cereal, and then I will. That's a way for me to go into it, like, well, those are inflammatory foods, so here's what, how about we replace that with this and that, like, so usually, again, it could be just as, once you start asking, you feel comfortable, once you start asking, how's your diet, let's break it down, what, how about replacing one thing, it like in one meal, maybe replacing your muffin with something with high protein and high fat first thing in the morning, so that way you're not having these sugar spikes throughout the day and crashes, and regulating your glucose levels a little bit better. So yeah, I mean, it's you just gotta start asking, and you don't have to be a nutritionist to change their entire diet, but just certain, like, recommendations may just be something they just remember. I mean, they'll remember, and I have patients that come back and tell me, they'll tell me, you diagnosed me with celiac disease, and I'd be like, what? Or and they're like, I didn't know I had all these problems, I thought they were normal, and then you told me to go off gluten, and now and I'm not saying everybody has to do gluten free, but just something that just happened like last week. A patient told me that I didn't do any testing, I didn't do any GI testing or anything like that, which I do like stool testing to really get deeper, like patients that want to do more like assessment of their microbiome and things like that, we can get pretty detailed. But as far as like just saying that alone, how do you feel after you eat pasta? And if they're like, I feel lousy, I feel really sleepy and like bloated and things like that, I'd be like, okay, how about for 1 month we do this change, But yeah, it's doesn't have to be too complicated. It can just be simple recommendations like
Well, I
water.
do know that you have just sparked a big light bulb for Jackie here, talking about you are sending your patients out for stool sampling. So
No,
you're
I
gonna have to elaborate on that. There's no chance we're letting you off the hook.
I
I know, I saw her eyes.
I was like, wait a minute. I have so many questions. I'm like, are you doing this in the office? You're sending patients out for what is happening? I have so many questions.
Yeah. So in
I mean,
office,
really, she does it all. I really am
there's
impressed. She's making her own serum tiers and PRP.
That's what I'm saying.
And respect for Mila.
That's what I mean. I'm like, she probably does it in her office. I don't know. Please tell.
kits. I order the kits, and the patients get kits shipped to them. So they do the poop sampling at home, and then they send it to the lab. So I never get to see it. So I don't have to look at any stool samples. Yeah, so they get, but I get the results. And I interpret it, and I talk to them. Dysbiosis, imbalance of the gut microbiome, is like the biggest thing, and the world of microbiome, which is what I love. I love studying the microbiome. I love, talking about it. But that's where most people, I mean, 8 to 9 out of 10 diseases, and that's for mental health, like depression, anxiety, heart disease, diabetes, hypertension, dry eye, uveitis, AMD, glaucoma, all have been proven there's dysbiosis. So dysbiosis is the root cause of most, chronic diseases that we have. So I think this is really going to change the way we practice in the next 10 years. I mean, we've really learned about the microbiome a lot in the last 10 to 15 years, and the research is coming out for eyes. Like, I mean, we've learned, we have really strong evidence for systemic diseases, but the eyes, we're kind of catching up in the eye world with the whole microbiome. But the research is there, it's coming out, and I'm like watching these and I'm like, yes, finally. And so then we can really, like, yeah, you can order a stool test and you can be like, your gut is messed up. So until we fix that, we're going in circles with your eye, with your rosacea, with your dry eye, because the analogy I like to use with patients is like it's a forest fire. Like when you have forest fire, and I'm just putting out, like, I'm just, putting water on just few trees here. I need, if the gut is, if you have leaky gut, if you have dysbiosis, your gut is just, a mess. You're just releasing, inflammatory. That's how we communicate. Our gut microbiome communicates with the rest of our body, with our endocrine system, with our, nervous system, with everything. So if that's not healed, if that's not addressed, then we're just gonna keep going in circles on the surface. So that's kind of what, and I see, again, patients know it. They're like, I've had gut problems for years and nobody can fix it. I thought it was normal. I was just told, to cut out this one thing or that thing. But there's protocols. There's things that we now know how to heal the gut.
So I'm still interested in this because I feel like it's almost like a quest test, right? Like early show markers or something. How do you get started with doing this? Because I can totally see myself doing this.
Places like GI, I use a couple different diagnostic tests, companies. Genova is a good one. You can get started with Genova Diagnostics. GI Map is Diagnostic Solutions, I believe. But if you actually go to Rupa Health, it's a basically like a big, it's a platform for doctors. But as OD, I had to kind of or like I had to really, get myself like, basically they were like, yeah, you're you're an optometrist, we don't do testing, or we don't allow optometrists to do testing. So I had to actually show, my license. I had to,
Explain what you did, right?
but once you get through that hurdle, you have access to all these like functional medicine testing. So you could do, hormone testing. You could do, micro nutrient testing. So if you wanted to use, do blood tests, again, these are kits that get sent to patients, so they can take to, if it's a blood test, they can take to like a lab, and, or like a mobile phlebotomist. But other things like for gut is through stool test, the kits that the patients get at their home. But Rupa Health is a good resource because it's all of those testing in one place. So you basically choose your menu of, and all these companies, I think they have like 25 different labs basically in one place. So you don't have to like have an account with each separate lab. But most of these are not covered by insurance. So a lot of times it's, self-pay, which makes it kind of easy in a way. I mean, obviously that could be a barrier for some, but then you don't have to deal with, you can either collect the fees yourself or have the patient just pay the lab itself when you order it.
This is a very interesting topic. I feel like we can talk about this for a lot longer, but before I forget, can you tell us like where we can find you and where people can find the nutrition program if they want to take that?
Yes, so my clinic website is southwaterfronteyecare.com. So, and this program is linked there, or you can go directly to dryeye-nutrition.com. That's the program link directly.
it's open to anyone's patients. So we could send our patients to this website and they could enroll in the protocol.
Yes. And this is one of the reasons why we wanted to put this protocol together, because we wanted to have this access or have this program available to our colleagues who basically, have patients who are asking, what can I eat? What can I not eat? And you can be like, well, here's a program, if you wanted like really tailored protocol for dry eye, you could do this. So you could, have it, just send your patients to the website, or even like if you wanted some sort of brochures and things like that, we can send that. We have like postcards and things like that for patient education.
And what is your Instagram too? Because although we only first met at Academy, I feel like we've known each other for a very long time, but that's just social media that'll do that to you. But tell people where you can tell you your Instagram too.
Yes, it's I Dr. Mila. That's my handle.
I will have to report back to you at how good I am at doing gut health sampling, and I'm excited to be able to go.
I love it. I submitted a outline, hopefully at the academy. So hopefully we'll get this conversation going more, and talk more about the microbiome and the link, and more of us, more doctors, more of our colleagues will be doing.
I'm sure you're linked up with the Sjogren's Society, and if not, you should definitely get linked up, because I feel like a lot of that research with gut, they're even doing whenever they replace your stool, like they do the
Oh
stool
yes,
transplant for
yes,
Sjogren's patients. So that would be a good resource for you for sure.
yeah, absolutely.
Well, Mila, thank you so much for telling us about stool samples and nutrition today. This was really lovely. Thank you for joining us. And yeah,
More importantly, just for, taking a deep dive into what other things fuel the dry eye patient,
yeah.
because too many times people give up with, step one or two. And I think, it is almost like an onion, right? The more you learn, it seems like the more layers you keep peeling back. And I think it's exciting to learn about all of these things, nutrition. And then when we dig into like corneal nerves and just how complicated it really is, it's amazing to think that there are people still neglecting the disease. And patients really appreciate doctors like you for really going all in, and really trying to find the next step before we really know what it is. So it was really exciting to learn from you.
Thank you. I really appreciate having, or been invited to be here. So thank you so much for having me. This was really fun.
And now for the To The Point wrap up. Remember, when we're dealing with our dry eye patients, it's more than meets the eye. We need to take a step back from our patients and view them as the entire body. Part of this is nutrition. Part of this is even things like gut health and balance of our GI system. There's some great takeaways from this podcast for teaching your patient about healthy lifestyle as it pertains to stress management, diet, exercise, and even exploring a little deeper into the gut biome and how that might influence your dry eye patients.